Dr. Mary Hohenhaus.
And I'm Dr. John Vitelli.
Today, we're going to review how to respond to a medical emergency at Butler Hospital, as well as review some of the emergency medical equipment that's available to you here.
We know that caring for a patient who is medically unstable can be very stressful. But if you familiar yourself with the basic steps that need to happen during every medical event, you will be better prepared to give your patients the help they need.
Today we'll be reviewing the definition of a medical emergency, what happens when the code blue alarm is activated, the roles of the physician and nurse code leaders, tasks that may be assigned during a medical emergency, and that you should be prepared to perform as appropriate to your role. What's different about responding to medical emergencies in locations other than an inpatient unit or PAS? What's different about responding to medical emergencies that involve a coworker or a hospital visitor? The contents of the orange emergency equipment bag, and oxygen delivery devices, automatic external defibrillator, and suction units.
A medical emergency is any condition that potentially threatens a patient's life. Examples of medical emergencies include cardiac or respiratory arrest, some heart arrhythmias, severe respiratory distress, sudden and persistent loss of consciousness, a seizure lasting more than 5 minutes, major physical trauma such as severe bleeding or hanging.
So you may be wondering what to do for a patient who you think needs to see a physician as soon as possible, but doesn't quite meet our definition of a medical emergency. What should you do? Weekdays between 8 a.m. and 5 p.m., you can ask your unit secretary or the hospital operator to page the first call internist, and either Dr. Vitelli or myself will respond. At all other times, contact PAS and ask to speak to the doctor on call.
A medical emergency can occur anywhere in the hospital at any time. First, let us review how to manage a medical emergency that occurs on an inpatient unit or in PAS. Later on, we will talk about differences when an emergency occurs in other areas of the hospital.
In the event of a medical emergency, the first nurse on the scene immediately takes charge of the environment and assesses the situation. The nurse code leader should use the SBAR format, SBAR, when communicating with others as they arrive. One of the nurse code leader's first tasks is to direct a staff member to activate the code blue alarm or blue buzzer. If you activate the code blue alarm, be sure to press the button firmly for a count of 5 to be sure that it activates.
Once the alarm is activated, code blue in its location will be announced overhead on inpatient units, in PAS, and in pharmacy. The medical emergency response team will respond weekdays until 5 p.m. The doctor on call will respond overnights, weekends, and holidays. Each unit will send a nurse. Pharmacy will respond when the pharmacy is open.
The nurse code leader will direct another nurse to call Providence Rescue. The nurse who calls rescue should give a brief description of the emergency and its location, again using the SBAR format. The nurse should then call Butler Security with that same information so that security can provide an escort to rescue when they arrive on the grounds, and so that security can provide other support to the unit as needed.
If the patient is pulseless or not breathing and code status allows, the nurse code leader will direct responders to initiate basic life support immediately. BLS protocol continues until rescue personnel arrives and assumes care.
Key tasks for the nurse code leader are summarized on a laminated card attached to the orange emergency equipment bag. Here are some examples of key tasks that the nurse code leader may assign. Direct responders from the unit entrance to the patient's location, assist with CPR, retrieve emergency equipment such as oxygen, suction, the AED, the orange equipment bag, EKG machine, or backboard. Retrieve and/or review the patient's chart, document events and the time they occur on the medical emergency documentation form, manage the needs of other patients on the unit, direct unneeded responders off the unit as appropriate.
The first physician on the scene is the physician code leader and remains with the patient until relieved by another physician or rescue personnel. Key tasks for the physician code leader are summarized in a laminated card attached to the orange emergency equipment bag. The physician code leader is also responsible for summarizing the event using the S-bar format when handing off patient care to another physician or to rescue personnel.
The nurse and physician code leaders work together to coordinate the required tasks. The nurse and physician should put on orange emergency vests located in the orange emergency bag as soon as is practical so that others can recognize them as the code leaders as they arrive on the unit.
If Narcan or EpiPen are needed, remember they are stored in the medication room cupboard and not the Pyxis. Any other medicine or medication ordered during the course of the code blue is removed from the Pyxis under the patient's profile or by an override.
One of the most important skills you can bring to a medical emergency is your ability to communicate clearly. Use S-bar, call out, and check back communication as appropriate. If you are assigning a task, call the person by name or point to them to tell them what it is you need them to do. If you are accepting a task, repeat it back to the person who assigned it to you so that they know you heard them and understand what they want you to do. Be sure to report back to them as soon as you have finished the task.
Once rescue transports the patient, there are still several important tasks to complete. Complete the handoff. The nurse and physician code leaders should call the report to the receiving emergency room. Document the event. Be sure the medical emergency response team documentation form is complete. The nurse and physician code leaders should document the event in Avatar. A report should also be entered in Quantros. Complete any open orders. The physician code leader should enter and sign any verbal orders in Cerner. Call the patient's family or emergency contact as appropriate. Last but not least, debrief the team.
What if the medical emergency occurs somewhere other than an inpatient unit or PAS, such as the Arboretum or a partial hospital program? Well, all of the tasks that we've just reviewed still need to get done. As soon as it has been determined that a patient is experiencing a life-threatening event, the code blue alarm should be activated. If there is no blue buzzer in the area, call the hospital operator who can then call the code blue. Post a staff member at a visible location to direct responders to the patient. The first physician and nurse to arrive are the code leaders. Physicians and nurses responding to a code blue outside of an inpatient unit or PAS should identify themselves as soon as they arrive. A physician or nurse must call Providence Rescue. Any emergency equipment available in the area should be brought to the patient's side. A physician from PAS will respond, bringing the red emergency bag. This bag contains a suction unit and glucometer in addition to standard medical supplies. A pharmacist will respond with an emergency bag of medications during the hours that pharmacy is staffed.
What should you do if the medical emergency involves someone other than a patient? What if the person experiencing a medical emergency is a coworker or a visitor? If the situation meets the definition of an emergency, that is a potentially life-threatening medical condition, then follow the medical emergency protocol. There are a few differences. If medication is taken from a pyxis, you use the John Doe protocol to assess the medication. Documentation for an emergency involving an employee must be submitted to the Occupational Health Office to be included in the employee health record. Documentation for an emergency involving a visitor should be submitted to Risk Management Office. If the situation does not meet the definition of an emergency, visitors should seek help from their own physician or an emergency room, and employees should report or speak to the occupational health or their supervisor.
Let's take a few minutes to review the equipment available to you in a medical emergency. Every clinical area has an orange backpack with emergency supplies, an automatic external defibrillator, a suction unit, backboard, and oxygen delivery supplies. Be sure you know how to access them in your work area. The orange backpack has a variety of supplies that you may need during a medical emergency. The zippers are secured with a small plastic lock. The back pocket of the bag contains a clipboard, the medical emergency response documentation form, and a pen. The front pocket of the bag has a zipper with a lock. So you break the lock to open it. This pocket contains some of the equipment that you might want access to right away, such as the trauma shears, ambu bag, simple face mask, non-rebreather mask, nasal cannula, rubber gloves, stethoscopes, and blood pressure cuffs. This is also the pocket where you will find the orange mesh emergency vest that the nurse and physician code leaders should put on to identify themselves as the code leaders. The middle section of the bag also is closed with a lock. It's divided into two compartments. One compartment has a variety of dressing supplies, ABD pads, cling wrap, and various sizes of gauze, as well as tape and alcohol wipes. The other compartment contains ice packs, a large absorbent dressing, several Chuck's pads, a Sharps container, and a flashlight. This is an oral suction unit. It is plugged in to charge when not in use and should be unplugged for emergency use. This is an automatic external defibrillator, or AED. Next, let's review each of our oxygen delivery devices. It's very important to remember that each device requires a different flow rate of oxygen. Be sure to pick up a copy of the oxygen delivery device reference sheet today. It summarizes how each device is used. It is also posted where emergency equipment is stored. Nasal cannula, simple face mask, and non-rebreather mask should only be used when the patient is able to breathe on their own. Here are the oxygen flow rates for each device. Nasal cannula, 2 to 6 liters per minute. Simple face mask, 6 to 10 liters per minute. Non-rebreather mask, 10 to 15 liters per minute. Remember that the oxygen reservoir of the non-rebreather mask must inflate for oxygen to be delivered to the patient. If it doesn't inflate, turn up the flow rate on the oxygen tank until it does. This is the ambu bag. It is used when a patient is not breathing or is breathing but remains hypoxic despite use of a non-rebreather mask. The flow rate for the Ambu bag is 15 liters and higher.
Thanks for your time and attention. We hope this review of how to respond in a medical emergency has been helpful. We want to leave you with a few good habits so that you are prepared rather than scared the next time you are faced with a medical emergency. Know where the code blue alarm is located in your area. Know where you find the emergency equipment for your work area. Be familiar with the contents of the orange bag. Remember to use your S-bar call-out and check-back communication skills. Plan ahead. What task would you be able to do in the event of a medical emergency?